Hi, everyone. I'm pleased to be joined by Alex Cohen, founder and CEO of Hello Patient. How are you today, Alex?
I'm doing great. Thanks for having me on.
My pleasure. Let's jump into the interview. If you could just start, Alex, by giving us an overview of Hello Patient and the specific types of problems you're solving in healthcare.
Yeah, absolutely. I guess I'll give some backstory first. I was at Carbon Health for about 3.5 years. I led all of our consumer and growth product there. And so for those that know Carbon, we had quite the rise during 2021, 22, went from 30 physical clinic locations to about 150 very quickly. And it was fun to be at the forefront of that. And so everything you see that touch patients digitally, the app, check-in experience, bill pay, letters in the mail was all my team. And so saw a lot of stuff that way, which I guess, takes me into the into your question of like what we're solving for in healthcare communication. But, just notice that everything as you especially like scale clinic operations tends to break as you go from 5 to 10 to 25 to 50. And there's lots of different problems at each stage along the way. But generally, the universal truth is that your clinic phone operations will essentially break down as you scale. Like the front desk staff can't actually keep up with the number of calls that are coming in. Patients still actually love to call their providers in order to get answers to their care. And then on the other side, you just have like all these, you start building big contact center customer care teams. And it's really hard to not scale that linearly as you grow for both an inbound perspective, just now you have all these calls going to the clinic, calls are being missed, you have to route them over to a call center. Now you have to go staff a call center to do that. But both on the outbound perspective, like how do you follow up with patients and tell them they have overdue bills and remind them of upcoming appointments and do all the things that require a bunch of outbound communication. And so we really like have a thesis that for most of these, like 80% of these routine administrative calls, we can automate using conversational AI. And that's really what we're working towards today is like, how do we sit as an extension of a healthcare practice or group and eliminate the need to have to hire one more full-time employer? Like just keep throwing bodies at the problem. How do you throw software at the problem that historically was only a problem that that a human could solve?
So, Alex, is your solution primarily targeted to like larger networks of healthcare clinics, or tell us a bit more maybe about your ideal customer profile and how you see that sort of unfolding?
Yeah, just given sort of the price point of where we sit and the amount of implementation effort that is required to actually get a practice off the ground, because they're all special in their own way. One primary care group is going to do something very different than another primary care group and have a different set of needs and requirements. And we, so we mostly go and target multi-site outpatient groups, sort of the private equity backed or rolled up organization, community hospitals, academic hospital, a few of the digital healthcare companies. And we're starting to do some work with value-based care organizations. But typically I would say multi-site is kind of the theme across them all, where you don't really start to think about centralizing call operations or just patient communications until you're 3 or 5 locations, usually even a little bit larger than that, because you start to feel the sort of seams break at the clinic level as you start to scale. And typically, like our ideal customer profile is some call center set up by the time that we end up working with them. It's pretty rare that a single provider group will end up, using a call center, having some centralized team. And so yeah, so that's typically where we operate is more in the mid-market to large outpatient group size and across a bunch of different specialties today. And focus on a whole bunch of different use cases, whether it be answering calls that come into the clinic and helping them do scheduling or rescheduling or providing after hours support or helping them, verify insurance, patients, verify insurance, or it could be on the outbound side. We do a whole bunch of calls related to bill pay or related to appointment reminders or enrolling them in chronic care management programs or doing some RPM work. So it's pretty extensible, but yeah, the general theme is like they're at a large enough patient scale and volume that they're considering hiring another full-time employee or multiple, and they can avoid doing that and use us instead.
And would they typically have like an IT team kind of on staff or outsource that? I'm just kind of curious how you interface kind of their current technical teams and whatnot.
Really depends on the organization. Most I would say like outsource things to some IT services group. Ultimately, what's important is like we'll have to integrate with the EHR in some capacity, but we do have other ways of working together. Like they could just send us spreadsheets every day of like patients who have upcoming appointments. Like we could, sit and sort of capture like HL7 feeds. Like there are other ways of working together that are not necessarily like a full integration into the EHR. But I do think, and you don't really need an IT team to do like if we're building the integration, we have the API integrations to like a ModMed or someone like that. You don't necessarily need an IT team involved at all. And that's kind of the nice thing about going that path. In some cases, like with the digital health companies, they have an engineering team and resources to like build against us. So that integration looks much different than your like 5 location dermatology group.
There any kind of cultural hurdles that you face when you're positioning your solution? What's been, I mean, obviously the value proposition must be pretty compelling, right? What's the receptivity to the notion of using AI to do this?
I think everyone is like interested and skeptical in the beginning. They're like, we want to try this. We'd love to like have it work so that we don't miss any calls. We answer 100%. We schedule more calls. We reduce hold times. We do all those things. But they want to start it in like a limited capacity, whether it be 1 or 2 of their locations out of the 5. For example, we are in the process of like kicking off with a health system, and we're just handling the nephrology group for them, like just doing answering for the nephrology group, even though they have cardiology, they have urology, they have a primary care group. And that is a pilot to be like, if it works here, it'll work in all these cases in all these other locations that we have and groups that we have, and we'll roll it out there. And that's really like everyone's interested. They want to focus on cost reduction, or at least like I wouldn't even call it labor reduction. It's just like expansion without labor expansion. Like you should like trying to avoid this trap of growing linearly headcount with growth. And so we'll typically that's been the reception is like we want to like I think the voices and the latency and the accuracy have gotten good enough where you can actually build a realistic agent now who can do a real job. But there is effort to get it live and to like prove that it works.
Yeah, yeah, yeah. I mean, it's incredible what's happening. What about from the customer's perspective? What's been their reaction? Like, do they even know? Is it gotten that realistic that like to them it's just like it could be like a whatever person on the other line?
I wouldn't say it's like fully past the Turing test there yet,
Yeah,
where you think that it's real. We also don't try to hide it. We disclose that it's a virtual assistant. I think for the most part, like patients really don't care as long as they can get what they're doing done. I mean, the minute that the agent can't do the job, they're like ready to go talk to a human, and they'd rather deal with a person and go through. They have more patience for a person than they do for a robot, and so it's a matter of just like being really fast and accurate and effective at doing the job that we're promising that we can do with the patient. And that is the most important piece of like driving high patient satisfaction. We operate across phone and texting. So texting is actually a really big channel that patients love. And so when we do a lot of asynchronous communication, and let's say I text you and I'm like, hey, you're overdue for your appointment, do you want to come in? You can respond to it on your own time. You can write back. You don't really know that it's a virtual agent on
yeah.
the other side, even though we tell you it's a virtual agent, because you don't care if the agent can do that work for you and get it done on your own time. And like those experiences are really, it's hard to find, like, to build a team large enough to keep up with the speed and efficiency of an AI agent doing, especially that asynchronous workflow, because as soon as that text comes back in, it's 30 seconds and we're replying back to the patient. Like to have a team staff to be that effective and have that short of an SLA would be quite expensive, and you'd have to have a very large team.
Cool, cool. So I know you were successful in raising funding. Obviously the buzz in the industry right now is just how tight everything is. What was your experience raising that, and what's your sort of sense of the funding landscape right now?
I think that there's a lot of money out there and not enough companies to go deploy capital into. I think generally like you have more funds who have raised money than there are good founders to go back. And so, when you look at like our space, there aren't that many folks working on this who are actually like good teams. And so really like I think raising the seed round was pretty straightforward, transparently. Like we raised the first just under four without launching. Like we didn't even have a company at the time,
Yeah.
essentially. We had just incorporated. Um, we raised a little bit more as like an extension to the round from our existing investors to go hire more folks in the engineering team because a lot of this stuff is quite complex to build. And then um, and as we think about like the next round of funding, I mean, I think every single fund is looking for a patient engagement multimodal solution to go put capital into. And I think at this point, it's really a question of like repeatability and scale versus, I think with the right customer traction and the right, sort of like early proof points, it should be, I'm not going to say it's easy, but like there's capital there to go raise, I think, for companies working in the space.
Cool. Well, that's good news. So
Yeah.
what are the maybe two or three most significant challenges then that you've seen growing your business to this point?
I mean, we're such an extensible product that like I think finding sort of the right early customer is always part of the challenge. When you think about like one of our biggest like one of the hardest things is like everyone has something to automate across the practice, and everyone thinks of a different, for some it might be accounts receivable,
Yeah.
for others it might be inbound answering, for others it might be like we launched this new program and we need to get patients enrolled. For some MSOs it's like we have RPM related issues and we need to like call patients and remind them to take their blood pressure readings, and it's like because of what we've built, sometimes it's you have to ask yourself like who the right customer is because you can almost do everything.
Right.
And so it's always a question of like, do we get really pointed and focused on a specific use case, or do we go wide and try to own the whole patient engagement stack?
Yeah.
And that's been the continual like back and forth
Sure.
challenge in perpetuity.
Sure. Kind of a nice problem to have.
Yeah, it's a good problem to have for sure. Like I think we're trying not to be relegated to a point solution. And and like but at the same time it makes the sales pitch a little bit more challenging than just like this is all we do and this is what you're buying and like that's it.
Right. 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 What about, I guess, compliance? I mean, obviously, comes to mind. What other maybe compliance issues have you run into? How have you resolved them?
HIPAA's really the big one on the healthcare side in terms of just like protecting patient health information. I think there's obviously like telephony regulatory and compliance constraints we have to operate within, whether that's like TCPA and 10DLC registrations or the FTC, the FCC, like, and actual like regulations or what we can or cannot say over the phone. And so we have a pretty good framework that we operate within with counsel to basically say like here's the requirements that we need on each of these calls and for each of these use cases and these campaigns. A lot of stuff we do outbound, and so you need prior express consent from patients, which typically that you have because these are not like cold lists of patients that we're reaching out to and saying come sign up for a practice. These are folks who have been through or have signed consent forms or been to the practice before. And so yeah, I would say like the compliance piece is actually not as tricky as just like the actual redlining of the contracts when you start talking to a large healthcare organization and they have a lot of opinions on what they want to see or not see in each individual contract.
Gotcha. Gotcha. Cool. Well, this has been really, really insightful. I mean, it's just incredible with, the whole AI agents and how that's going to change the workforce. What's sort of your overall read on it? Obviously, you founded an AI agent company. What's the role of the human and what's the sort of like that relationship going to look like in the future?
It's funny, like my pragmatic view is I don't think that agents are replacing like call centers or call center workers. I think generally agents are really good at doing specific tasks and functions within the organization. I think will augment teams pretty significantly. I think like every single healthcare practice will have their version of an agent that they procure to go do some tasks that they would normally hire a person to do. I think you'll see spend get compressed. I think you'll see like pricing get compressed over time as more people launch more and more agents that compete with each other here, which is ultimately a good thing for the patient and the practice, even though it's not as great for like from a business perspective. And so, but I think it's still so early, like probably 0.1% of healthcare is using an AI agent to do stuff over the phone. And there's so many different specialties, so many different unique businesses in healthcare. Like it's going to be a 10 or 15-year journey of just like bringing on more and more and more unique types of customers and like doing more work with them. And so, I think in 10 years, maybe you have fully autonomous like AI agents that can do everything that a front desk person would do or that a customer care center team would do. But I think we're pretty far from being a full replacement.
Gotcha. Cool. So just kind of in closing, Alex, what are maybe two or three key nuggets of wisdom that you'd share with fellow, healthcare AI CEOs who are trying to maybe navigate where you've gone? You've gotten funding, you've gotten a lot of traction in your business, since you'd share with them.
I mean, I think on the funding side, it's like you have to have a big vision and you have to, tell a really compelling story. I think, I think we've seen a lot in healthcare that is essentially like fizzled out in the middle, which is not necessarily what investors want to take bets on. They're going for zeros or home runs. There's not a lot in between. And so, I think building a point solution essentially relegates you to something in between. Going for a moonshot obviously is a very binary outcome. And then I think being like really opinionated about the world and how it should look and how it should operate is important as well as you're sort of crafting that narrative. And then, just like shorten, like being really, really fast to experiment and build and ship product and change opinions and learn. Like it's constant feedback loops. Like every day is a feedback loop for me as we meet more types of customers and learn more things and shift priorities and shift focus. And so that's generally my biggest advice is like follow what the market is telling you and don't be afraid to like continuously change your opinions or your viewpoint of the world and how it should operate. And so we do that all the time. Like we had opinions about some use cases that just frankly didn't work out. Now we have opinions and we're experimenting with other use cases that have much higher odds of success in terms of like efficacy with agents and whatnot. And so, and the world's changing so quick in the world of AI, like the LLMs are only getting better, the latency is getting better, like everything's just improving at an exponential pace. And so, you can sort of get lost trying to keep up with everything, or you can just like, get heads down and build the things that you can be quite competent at.
Yeah. Well, that's actually really interesting insight. Nobody I've interviewed probably 50, 60 CEOs, and nobody has brought that up, but I think that's just really important, right? I mean, you think from a VC's perspective, I mean, you're right. I mean, like why should they put skin in the game if there's very limited upside? They want the home run, and the only way that they're going to buy into that is if you create the vision for them and be really whatever, just determined, right? That's the way it's going to be. You have to have a very strong point of view, I guess, and to be whatever compelling and persuasive, right?
Yeah, I mean, I think you shouldn't raise venture money if you're not going for a moonshot generally. You shouldn't lie about going for a moonshot. Like we have very large aspirations and goals, and there's a path to get there, and it may look sort of small in the beginning, but like that's generally the stepping stones to something that's much larger, longer term. And I mean, when you think about just the economics of a fund, it doesn't make sense to get a bunch of 2Xers or 5Xers. Like they need 100X or 1,000X. And so, if you're raising at a $10 million valuation, I'll just throw out like a simple number, essentially like you have to be the multi-billion-dollar company to return that fund several times over. And so if there's not a realistic path to get there, VCs are not aligned or incentivized to invest in the middle. And so, you're much better off raising from angels who wouldn't love a personal 5 or 10X return. It's just a much different investor profile. And then of course there's like private equity and growth equity and all this stuff that actually like does care about the 2 to 5Xs. But generally early stage, like, choose, are you going to go raise $2 million from a bunch of individual investors and just go build a nice profitable healthcare business that serves, maybe gets to like, some material revenue number, but it's not the hundreds of millions of dollars per year? Or, if you're going to go raise venture, like you're taking a really, really big swing and typically building something that unlocks that swing. Like we spent the last year building very extensible, what almost looks like marketing automation software for healthcare practices. And that unlocks the ability to go to someone who's like a 100, 200 location chain and say, let's go handle 1 million calls a year for you without any people.
Yeah. It's really interesting because again, like I talk to a lot of really smart people, like MDs that whatever they recognize a problem, they are creating a solution, but at the end of the day, it's just you have to wonder whether the total addressable market is large enough. Um,
For sure.
yeah,
Um, yeah, no, for sure. And I think TAM is always an interesting metric to like get hung up on during investing because like ultimately the best companies do grow their own markets. I think what I also invest, like I've had a fund for a few years. When I was at Carbon, I was doing a lot of investing, and ultimately like the biggest thing is like one, you're obviously like you're making a bet on the founder. That's 80% of it.
yeah,
10% is like is what is the market? Like, is it a big enough market, or or like interesting enough product? And the other 10% is like what happens if everything goes right? And ultimately like you're underwriting to that like last 10%, because if everything goes right, like let's say everything goes right in our world and we become like the leading patient engagement platform that like doesn't staff, like essentially like what happens if we become the largest BPO that doesn't staff any people doing
yeah.
tens of millions of calls per year and all these like functions for healthcare practice? Like that is a multi-billion-dollar year revenue business that doesn't staff any people, and that's really interesting. um but if you look at like, hey, we're a I don't know, like a form builder for doctors' offices. Like,
Yeah.
what happens if everything goes right there? It's like, cool. You maybe are making $100 a month per like provider office per year.
Yeah.
It's just way less of a story to tell, and you just have to weave it into something a lot larger.
Wow. Well, fantastic. Thanks so much for sharing that, Alex. This has been a really cool interview, and congratulations on your success and all the best going forward.
Yeah, thanks for reaching out.
My pleasure.